Are you worried about an HbA1c result of 50? You're not alone, and understanding what that number actually means is the first step to knowing what to do next. HbA1c is a blood test that reflects your average blood glucose over the past 2 to 3 months. It's measured in IFCC units, the standard used across the NHS. A result of 50 millimoles per mole sits above the diagnostic cutoff of 48 millimoles per mole for type 2 diabetes. So yes, this result is in the diabetic range. But here's something important. If you don't have symptoms, NICE recommends a second confirmatory HbA1c test before a formal diagnosis is made. That second result also needs to come back at 48 millimoles per mole or above. So one result alone doesn't always seal the diagnosis. Your GP will guide you through that process. It's also worth knowing that HbA1c isn't a reliable diagnostic tool in every situation. If you're pregnant, if type 1 diabetes is suspected, if you have certain blood conditions like hemoglobinopathies, hemolytic anemia, or iron deficiency anemia, if you're on hemodialysis or have chronic kidney disease, if you're a child or young person, or if you've had a recent blood transfusion, your doctor may use a different test instead. So what can actually be done? Lifestyle changes can make a meaningful difference. NICE recommends at least 150 minutes of moderate aerobic activity per week, things like brisk walking, cycling, or swimming. Dietary changes and weight management also play an important role. Your GP may refer you to a structured education program such as Desmond or Expert, which are specifically designed to support people managing blood glucose at this level. If medication is needed, the first-line option for type 2 diabetes is typically metformin. It works by reducing the amount of glucose your liver produces. Your doctor will check whether it's appropriate for you. Always take any medicines exactly as prescribed, as this video provides no dosing instructions. When it comes to targets, NICE guideline NG28 recommends an HbA1c target of 48 millimoles per mole for most adults managed with diet alone or with non-hypoglycemic medication. If you're on a sulfonylurea or insulin, your target may differ to balance blood glucose control against the risk of hypoglycemia. Targets are also individualized for older or frailer adults, so your doctor will discuss what's right for you specifically. You should speak to your GP promptly if you've received this result and haven't yet had a follow-up appointment. Don't wait. If you're experiencing symptoms such as increased thirst, frequent urination, unexplained tiredness, or blurred vision, mention these when you call. For urgent but non-emergency concerns, you can also contact NHS 111. And if you or someone around you experiences vomiting, confusion, laboured breathing, or other symptoms that suggest a serious emergency like diabetic ketoacidosis, call 999 or go to A&E immediately. These situations cannot wait. To recap, a result of 50 millimoles per mole is above the UK diagnostic threshold for type 2 diabetes and needs prompt clinical review. If you have no symptoms, a confirmatory repeat test is required before a diagnosis is confirmed, and lifestyle changes alongside any medication your doctor recommends can meaningfully support your blood glucose management. This video is for general information only and does not constitute medical advice. Please speak to your GP or a qualified healthcare professional for advice that's personal to your situation. If you found this helpful, leave a comment below. We'd love to hear your questions. And for more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel.